Hello, my name is Veronica Green. I'm a nurse practitioner here at EP Premier Medical Group. Today I wanted to talk about prediabetes. According to the Centers for Disease Control and Prevention, about a third of adults over the age of 18 in the United States are prediabetic. 90% do not even know they have it. Unfortunately, 70% of people who have been diagnosed with prediabetes will eventually go on to develop diabetes type 2. So I have patients ask me all the time, what is prediabetes? Either I have diabetes or I don't. Prediabetes is essentially a red flag or warning sign from your body that steps should be taken to improve your health through diet and exercise so that you do not develop diabetes. Unfortunately, at this time, there is no cure for diabetes. Once you have been diagnosed, you will always have diabetes. Our goal here at EP Premier is to work together to provide you with the tools needed to prevent that diagnosis. So what causes prediabetes? When we eat, our digestive system turns carbohydrates into glucose or sugar that enters the bloodstream. Sugar is good to a point. It's used to power our bodies or provide energy. Insulin is a hormone that is released by the pancreas that helps move glucose from our bloodstream into our body cells to be used as energy. In prediabetes, the body doesn't make or use the insulin hormone properly, causing too much glucose to build up in the blood, which can be harmful to your body over time. Prediabetes is when your blood glucose levels are higher than normal, but not high enough to categorize as diabetes. Risk factors for prediabetes include being overweight, having a waist size larger than 40 inches for men and 35 inches for women, because this increases insulin resistance. Eating diets that are high in fat and carbohydrates. Carbohydrates are foods such as tortillas, rice, pasta, potatoes, corn, bread, and sugars. Other risk factors include lack of exercise, being 45 years or older, having a relative who has been diagnosed with diabetes, smoking, or women who had diabetes during pregnancy. Pre-diabetes typically does not have any symptoms. Testing for prediabetes typically occurs with a blood test called a hemoglobin A1C, which measures your blood sugar levels over a 3-month period, although other tests can be performed. When the hemoglobin A1C is higher than normal but lower than levels seen in diabetes, a diagnosis of prediabetes typically occurs. The good news is that if you have been diagnosed with prediabetes, you can make lifestyle changes to return blood glucose levels to normal ranges and prevent the progression to diabetes. A weight loss of 5 to 7% by following a low-fat, low-carbohydrate diet and exercising a minimum of 30 minutes a day, 5 days a week, can reduce your risk of developing diabetes by 58%. In some cases, depending on your risk factors, your provider may recommend a daily medication called metformin to help this process. If you have any of the risk factors mentioned, you may want to speak with your provider to see if testing is appropriate for you. If you are diagnosed with prediabetes, I recommend you take steps immediately by implementing lifestyle changes to prevent the progression to diabetes. Your body is essentially telling you this is go time. If you have any questions, please feel free to speak with your provider. Together we can help slow, or even prevent diabetes. Thank you.